How would you describe the intense work environment during COVID?
It was very intense in terms of handling very ill patients, and as most of them comes in as emergency cases, most of them are breathless. Their SpO2 is very low, so we have to treat them as emergency cases. We administer oxygen, we give them immediate attention. Continue, we give prescribed drugs, we continue observing them. Most of them they are diabetic, we check their sugar level regularly, and most of them that are hypertensive, we check their blood pressure. And some of them the anxiety is the anxiety will be there because they hear that they are COVID-19 positive. The fear comes in, so we allay their fear, the fear and the anxiety. The relatives too, they are anxious, so we talk to them, we reassure them, and we prevent the transfer of the infection because it's a global infection, and it's easily transferred from one person to another. And so we prevent that one, so that we minimize the number of the people affected. So it was very intense. Is that we have to keep on observing them, we don't really leave them, and we treat the relative too. We check we make them to undergo test, so that we know if they are being infected also. So if they are infected, we take care of them also.
What do you do to unwind after a busy day at the hospital?
Yeah, after I visit there at the hospital, I spend time with my family, my husband, my children. I watch films, television, and I read novels. I chat with my friends. I call them to assure them, to know of their safety, and to advise them to take care of themselves and to prevent themselves from being infected.
As a health worker, what advice do you have for other nurses on how to unwind after a busy day?
As health workers, I advise my colleagues to rest well, to watch television if they are able to do it, to chat with their friends, spend time with their family, check their blood pressure. Some of them might not be hypertensive, but because of the intense work we are doing, they come they come up with hypertension. So they need to check their BP regularly, check their blood sugar, and make themselves okay, and get safe.
Thank you very much.